There is a potential breakthrough involving the brain disease CTE, which has been found in the brains of people with repeated head trauma, including a lot of former football players. Now, the only way to find the disease is to examine the brain of a person after death, and that has been a major obstacle to diagnosing CTE. But now researchers may have found a way to test living patients. So joining us now to discuss is Dr. Chadwick Hales. He is a neurologist at Emory Hospital. Thank you for being with me. This is significant. What did they find that would lead them to believe that maybe we could test someone who is alive?
Sure. So the investigators at Boston University took samples from subjects who had been diagnosed with CTE post-mortem, and they took those brain samples and spinal fluid samples and tried to identify specific proteins that may be increased in those samples. And what they identified is a particular protein called CCL11 that may be involved with inflammation. Now, the reason this is interesting is that the goal for diagnosing CTE, Alzheimer's disease, a lot of neurodegenerative disorders, to identify specific biomarkers that can label what those patients have in their brain. And so what they did is they found one of those particular proteins.
So if we can find that marker, maybe we could test for it when they are alive. Are we looking at a time frame here as to when that might happen?
It's always hard to say, but I think within the next few years we will definitely have some type of a marker that we can use in not only patients who may be at risk, but perhaps those who are already symptomatic. And of course, these types of studies, this study was pretty small and will have to be validated with larger cohorts. And that is one of the challenges with biomarker validation in general, is making sure that you can reproduce those studies in a larger group of people.
There's a great concern here. I want to talk about a new study. It's about tackle football and children who start playing before the age of 12 and how their vulnerability and their brain development could be affected. Tell me a little bit more about that study.
Yeah, also an interesting study. Basically, again, at Boston University, they asked questions to groups of people who had played football over a period of years, and did some retrospective correlation analysis where they looked at what their prior playing history was. And basically the finding was that in those players who had perhaps started earlier in their life, that they were showing an increase in amount of neuropsychiatric problems such as depression and things like that. It's far from confirmatory that the time frame that you're playing is going to lead to increasing symptoms, but it does continue to support the hypothesis that perhaps a longer duration of the repetitive head injury may have impacts.
Significant studies to discuss. Dr. Chadwick Hales from Emory University, thank you so much for being with us.
You're very welcome. Thank you.